So I'm Dr. May, Dr. Ben May. I am a family medicine physician. I work in primary care at Mason Health. I also work on the hospital side of things in the inpatient setting and with newborns in the nursery. I started in July 2020. Choosing medicine for me, it was a bit of a roundabout path. I started college with intent to go into music as a music major. And then I later switched to, I took a chemistry course and realized that I really loved it. And I was just trying to fulfill some requirements. And I pretty quickly switched to a biology major with the intent of going into medicine. I realized that it was a lot of fun, a lot of challenge, and something that I could really see myself doing for the rest of my life. My wife's from Arizona, and we met in college. She ran cross country there, and I'm from here, obviously, so we were looking for somewhere on the West Coast, and I ended up going to Pacific Northwest University in Yakima. I had the idea of going into rural medicine pretty early on when I made my choice. I volunteered a lot. And there are clinics in rural Virginia, Tennessee, in the southeast called remote area medicine clinics. And I really gained a appreciation for the challenges in rural areas. And so that kind of fed me into medical school thinking I'd like to do rural medicine, which persisted until residency. And I chose a rural training program where I could get more training in, with patients in rural areas, managing their complex and different needs than you'd see in patients in bigger cities. I rotated here as a medical student, actually at a few locations in the hospital, in the eye clinic, and pediatrics. And I got a good feel that the doctors are happy, they get well supported, they give good care to the patients, which is the most important thing.
Dr. May and myself, our particular residency team or group or cohort, I think was pretty unique in the sense that we were a very, different bunch, but a very close bunch.
Yeah, I think that's true. I think there's a good idea of camaraderie in the clinic around here. Like what Dr. Kwan was saying, in our residency program, we had that from the get-go also. And so it was, honestly, it's an attractive portion of working here is that it's a good family environment, and a good environment where everyone feels like they belong and can corroborate. If I have difficult patients, I can go talk to just about anyone about it.